In past work to deliver micronutrients, expanding access to fortified rice, for example, how has the private sector engaged and how has this developed over time?
Sure. So just take a step back. Nutrition, if you think about it, probably it should be our leading target for intervention. There's more death and disability caused by nutritional problems than any other risk factor. And that's a problem both with undernutrition, micronutrient deficiency, as you talked about, as well as overnutrition. The thing that's interesting, if you think about it, is we all eat, and almost all the food that we eat, we buy from the private sector. And so when you're thinking about really sustainable solutions, you have to be thinking in the private sector. Take micronutrient deficiencies as an example, vitamin and mineral deficiencies. It's really by fortifying food that's commonly eaten that we can solve that problem. So the big history there is salts, where iodized salt really solved the problem of goiter in the world over the last century. But micronutrient problems remain, and so PATH has been working on a product for several years now that's a fortified rice product. Rice is one of the most common staples that is eaten, and fortifying rice with essential vitamins and nutrients can actually solve that problem. But that rice needs to be sold by the commercial sector. And in fact, when you think about it in that way, we're providing the private sector a product that consumers want, it's healthier for them, and it's actually relatively easy to make happen. So we've been very fortunate in countries like Brazil and India to have small private sector companies step up and say, I actually see a market niche for this product. I see something that I could sell that my competitor can't. Let me step in and help make that happen. And then as a consequence in Brazil, millions of Brazilians are eating this rice product. And in India, many of the school systems are actually adopting this through this private provider as a product that they're marketing to school kids.
And in terms of integrating nutrition into every phase of healthcare, how can different sectors collaborate and how can this be improved?
I think traditionally the health sector has thought of nutrition potentially more as a health problem, and so we've been kind of limited in our solutions and have thought about, well, how can we have special clinics that give out food, or how can we provide education about nutrition in a clinical setting? Those things are helpful, but the reality is that nutrition is a multi-sector issue, and therefore our approaches to it need to be multi-sector. In particular, as the world is urbanizing and as more and more people are living in cities, we need to be focusing on how is it that we're getting high nutrient, fresh food into the city environments. And in fact, if you think about it, there's a market niche there because there's a whole bunch of people who want that product, and there are very innovative ways when you're thinking about the food chain for making that happen by growing foods closer to cities and getting them there, by using novel sources of animal proteins that have less of a carbon footprint and are cheaper to produce, and getting them to cities. So the issue here really is one of ingenuity and innovation. The need is there, the opportunity is there, and just taking advantage of these approaches is the way that we need to be successful.